Great. Good evening, everyone. To my fellow Bangladeshi compatriots, happy Independence Day. I understand this is a very joyous day for us, a very festive day for us. Thanks for taking your time and joining us and Dr. Osama Elhassan for our evening's webinar. It is my very great pleasure to introduce Dr. Osama Elhassan, the chair of ZIMAM, United Arab Emirates, and he is a recognized leader in digital health and health informatics. Dr. Elhassan is a fellow of the International Academy of Health Sciences Informatics, and he has extensive experience in advancing digital health capacity, workforce development, health informatics education globally. His work focuses on strengthening competencies and building sustainable digital health ecosystems. Tonight, he will share his valuable insights on competency-based framework for digital health careers, which is very lucrative for our healthcare professionals and students who are looking forward to a rich future. Thank you, everyone. I'm going to pass the floor to Dr. Elhassan to begin his presentation. Sir, if you'd like to start. Thank you.
Hello everyone. So my name is Elhassan. Thank you very much, Zakir, for the introduction. And it's really my pleasure to be with you today. Unfortunately, I have like a hard tap, so maybe within 25 minutes, we need to conclude. So let me start. So my title today is around competency-based framework for digital health careers. So start with the agenda, talking about myself, what I'm doing, talking about digital health skills, digital health jobs, why they are important now. We'll take some opportunity also to talk about ZIMAM, which is our non-for-profit organization focusing on workforce development. I will talk on our research at ZIMAM and how we are tackling the issue of capacity building and building a kind of a standardized competency-based framework for digital health. I will talk about methodology and that we developed. So for this perspective, I will highlight quickly kind of like what are the future perspectives for future health jobs. And I will share what kind of partnership that we are developing as Imam and how we can work together on this perspective. So my name is Osama Elhassan. I'm a software engineer by training, carrying more 20 years of experience in digital health. So I work as a health informatics specialist at Dubai Health Authority, which is a local health regulators in Dubai, Emirates of Dubai. We work with many projects. So we have NABIB, which is our health information exchange platform across the city. We developed federal laws around data privacy and cybersecurity in healthcare. We developed also certification programs for digital health platforms like telehealth, telemedicine, and AI-powered platform. I wear many hats, especially on the NGO space. So I'm the vice chair of UAE Health Informatics Society. I'm also the chair of the UAE HL7. I'm chair of ZIMAM, which is a non-for-profit that focuses on capacity building. And we are actually an international association. However, I'm a board member also of the International Society of Telemedicine and eHealth, and also a member of the WHO roster for experts. I'm also a fellow of the EHASI and ACHDN. So why we are talking about digital health skills today? Why is this kind of an environment and a domain which is rapidly changing? So these are the characteristics of our domain now. So digitization is inevitable, as you know, it's becoming more demanding by all stakeholders, government, private sectors, and even patients today are getting into the digitization. AI is disturbing the whole ecosystem, exacerbating the digital divide and skill shortage across the globe. Especially in healthcare, people drive change, not technology. So comparing with other domains, we see that although the pressing need, the technology adoption in healthcare is more difficult comparing with other domains because it's still people-driven change. Another area that makes our life difficult when we introduce technology to our workflows is that ethics and accountability are still pressing concerns, especially with the introduction of agentic AI. And last but not least, most of healthcare organizations are flying data blind. So even today, we see a lot of CEOs, CMIOs jumping to AI. But however, from the data perspective, they are still way, way behind. And that's why they are just trying to catch trends rather than building the right infrastructure that support AI. And we always say data first. I won't say AI later, but if you have to handle your data issues today so you can really fly better with tomorrow. So that's is also a big challenge, focusing on trends and undermining the issue of skill gaps. Uh, So what is Zimam? So Zimam is a non-for-profit organization. It's an Arabic word actually, which means reign of horse. So it's kind of like a tool to steer and to support young talent on how they navigate through digital health and career pathing and promotion within digital health. Uh, so it's a short name for International Digital Health Workforce Development Collaborative. We are a Geneva-based non-for-profit association focuses on promoting international professionalism in the field of digital health, and we do that by enriching knowledge, building competencies, and fostering innovation. As I said, we focus on Middle East and low and medium income countries. Uh, so if we're talking about our vision, so our vision is inspiring creative models towards a sustainable reference of digital health communities. If you're talking about our mission, uh, so think, so this was our vision. So our mission is uh, promoting digital health professionalism through enriching knowledge, building competencies, and fostering creative. I don't know if the screen is it's a little bit delayed. I don't know why. Can you see my screen?
Yes, of course.
Yes, yes, we can.
Okay. So, with regard to the MAM achievements, so we've been doing annual events in digital health in 2018. Uh, we do a digital health innovation day to bring VCs, startups, and investors to connect together. We did more than 10 well-attended bespoke digital health workshops around I can say vertical areas, like for example, we did something around agentic AI. We did a workshop around the synthetic data in healthcare. So we cherry picked those kind of like trendy and important skills to focus on. We have a huge database of collaborators across the globe. We developed the first survey around digital health workforce. That was back in 2019. And I remember that we got around 600 responses from all over GCC and MENA regions. We developed the MAM Digital Health Awards, which was like a very nice tool to celebrate excellence in digital health across many domains like cybersecurity, privacy, connected care, value-based care. So we also selected certain domains so we can share excellence and celebrate excellence either at organization level or individual level.
এগুলোতে ভালো কিছু থাকে তো
And we developed a competency-based. Yeah, check. So one of our core uh, advancements or achievements that we developed the first ever competency-based framework for digital health. So we started our journey back in 2019 by creating a specific domain a model that was adopted by the Saudi Commission of Health Specialties, which included around 6 domains. And we started from there our journey to build competencies around digital health. So that was a very basic one. However, it was very well adopted by a number of government organizations. So we pushed forward with our research. So through our research group, We developed several papers trying to build more of, we put more flesh on the skeleton of our digital health, our competency-based framework. So we focus on areas around the emerging technologies, around building career pathways. So not only focusing on the skills, but only curate our competencies in a way that can help building also career paths. In the last 2 years, we started also to work more closely with some collaborators across the globe, like from Australia and from UK, and we came up with some sort of like more standardized competency-based framework that capitalizes on the success of certain international frameworks. And I'm focusing more here about Sophia. I don't know if anyone knows Sophia. So Sophia is one of the most well-known competency-based framework for digital jobs. So what we did with the support of the team there is to extend Sophia to cater for specific digital health jobs. So before we delve into these details, we just get some sort of a regional perspective about our challenges. So we see that in GCC, for example, we are moving very fast in investing in digital health. The overall expenditure on digital health, like for example, in Saudi, is around 50 billion, and we are expecting more between 50 to 27 billion of potential income with regard to the digital, or I can say, digital economy of digital health. What we think that we unique aspects of digital health in our region, that alignment between local healthcare systems and international standards, development of competencies, what that we are trying to do. Still, we have workforce data limitation for planning, and we need for cross-sector workforce adaptability. So these are the key areas that we need to incorporate in our plan. So this is our methodology. So we started with a strategic foundation, building a governance structure around it. As I said, we anchored around the Sophia competency-based framework. Second pillar was around workforce development. So we do targeted capacity building initiatives, workshops, as I mentioned before. And then we are trying to engage with our ecosystems in terms of like building strategic partnerships with government, with private sector, and with the non-for-profit sector as well. So this is what we are trying to do, building on Sophia, building stakeholder management, and then we develop our competencies for that. So when we do our kind of stakeholder mapping, we make sure that we bring educators, learners, we develop contents and approaches, we incorporate new trends, new technologies, and we are building kind of assessment and evaluation processes so we can engage perfectly our professionals by building and improving their technical skills, software skills, critical thinking, leadership, and so on. So this is just a very one slide that highlights what is Sophia. So Sophia is a very detailed competency-based framework for digital jobs. It includes 121 professional skills. And within every skill, there is a leveling. As you can see, that level starting from 0 to 7. And so that means that it captures all the levels of the skills, starting from watching or learning what's happening until you're becoming kind of an expert in this skill. So the idea of leveling of these skills is very, very, very strong, and we are building on it actually. So to build our competencies with Sophia, we partnered with many organizations like IDIR, which was the WHO initiative, and there's a Federation of Informatics Professionals UK, who also supported integrating health informatics jobs to Sophia. We are now also using OpenAir in our project to model those new competencies around digital health. So this is high slide presents what kind of extensions or digital health extension that Sophia has already. So talking about patient services, information governance, clinical safety, cybersecurity, clinical informatics, bioinformatics, and digital leadership. So these are areas where we managed to extend Sophia to cater for digital health. So this is an interesting slide because it shows in a nutshell, what is our methodology. So we are targeting three types of workforce. We're talking about healthcare workforce, clinician, nurses, allied health, digital health workforce, people who are coming from the digital arena with some knowledge of the healthcare domain. And finally, we're talking about leaders. So these three groups, they go across our tools of upskilling, cross-skilling, and reskilling. And the target will be developing digitally skilled health workforce or digital health employees or consultants, freelancers. So all those groups will be skilled, re-upskilled, cross-skilled to be able to cater for the new jobs, new missions, and new requirements of the digitally supported or AI supported healthcare systems. And to do this, we are now developing kind of a platform to support these concepts or these ideas. So that's why we have developed what we call Zimami, which is a tool that can allow talents to, for example, upload their CVs and automatically identify their skills and then suggest to them what kind of courses, micro credentials that they need to do to engage, to promote themselves in their career path. So if you see in the below that this is what the data that we can capture through building a talent profile, which is a competency-based talent profile. And then you can easily use our tool to compare yourself or to assess yourself against a certain role in healthcare. And then you can identify what are the missing skills that you need to get and how to get those skills by getting those one of those training programs. So this is in a nutshell what we are trying to do. So to do this, we developed what we call the Zimami platform, and we partnered with some digital health digital providers, digital platforms who are supporting us on this journey. So I will talk quickly about the new extension now that we are developing to allow building a standardized approach of building skills, jobs, and career paths. So we came up with a new approach that utilizes OpenAir. OpenAir is a kind of a clinical modeling specification, which is now very well known to model electronic medical records or health information exchange or any exercise around modeling healthcare data. The OpenAir characterized by what we say two-level of modeling. So we have level one, which is we call it the reference model, which has like constructs that can be extended to what we call the knowledge model, where we develop archetypes and specialization and templates that can build whatever model in two levels, where we can really uh, build things in phases. So as part of OpenAir fellowship program, I was able to build this kind of a domain model with the support of experts in OpenAir. So this is just kind of what a high level model that we developed. Based on that, these constructs like archetypes and templates. So we developed these models. I can talk a lot why we are trying to do this in two leveling approach, because the idea that I want to build it in a way that can be customized per countries or per healthcare system. Like for example, I can give you two examples. So suppose that we have two organizations. One of them could be a rural hospital in Africa, maybe Kenya or Ghana or Tanzania. And then we have another organization which will be in Boston, US. And both organizations, they are asking for health analysts, digital health analysts. Or so these two roles for sure they will have, although that they have the same name, but they will be different competencies because of many aspects. Like for example, the complexity of the healthcare ecosystem, the complexity of the organization, the digital maturity of the organization. So these kind of variables will affect the role description, the competencies required for the role, although they are the same roles. So we tried through this two leveling model to capture similarities and differences between those two jobs and make it easier for HRs or for people who are building these roles and competencies to easily build them through our technology. So as you said, you can see here, these are the variants that we develop that can help us building a role in two levels, generic level and then the specialization level, which will be affected by all those variants. So that's just an example of what we did. For example, for three jobs, data engineer, clinical informatician, and CIOs. So we have in the design time, we put the roles like the ICT profiling for those jobs, and then we affect them with the local variables, like for example, what kind of local competencies or local certification that is required for a job, comparing two countries, for example, and make this applied at the runtime level. And if you can see like those three roles, each of which has their own different competencies and different even evaluation and assessment approaches. So this is the way that we utilize the OpenAir to do so, as I said, in two levels. So before I leave, I can share with you some sort of like future perspectives on digital health jobs. So as you see that AI is getting more and more engaged with the digital healthcare systems, and we see a huge change in the on demands on competencies. So based on our research and our day-to-day activities, I'm showing to you now the top five roles that we are expecting them to becoming top demanded jobs in the coming 5 years. So, for example, clinical AI safety and governance officers, that this kind of role will be very, very important. Have data privacy engineers still there, but it's now getting more and more important because of the all use cases that we are seeing today around, say, cross-border exchange, data manipulated by AI agents. So there will be a lot of challenges around data privacy, and there will be a lot of demand for health data privacy engineers. AI augmented clinical work for workflow architects. That's also a kind of a new role that is becoming trendy these days, especially on organizations who wants to utilize AI, but still to do it, to keep it in a way that it will preserve privacy, it will preserve PIIs, it will preserve the identity of the organization, also the IPs of the organization. Also, another role, which is the clinical terminology data quality specialist, especially in AI and NLP. So to empower all those AI systems as of today, we need to make sure that the data that gets into these kind of AI models are data of high quality. And we need an army of people with multiple skills around technology services, around data standards, around NLP, how to move unstructured data to structured data. So for sure, this kind of skills will be still on demand. And last but then not the least, we are seeing now a lot of mobile apps coming into the market, which is helped in terms of digital therapeutics. And this could be at the disease level, and this could be also at the population level. So we see now a lot of screening programs today are moving from the traditional approach to becoming more of like digital apps that can use technologies like using camera videos to collect the vital signs of patients, putting questionnaires to identify the risk of getting a certain disease across the population. So this is requires a lot of skills and competencies around design, around integrating health AI data, healthcare data, phenotypes and genotypes as well. So that's becoming a kind of skill that is highly required. So this is just a very quick screen showing the network of partners that we have in Zinam across the globe and what kind of use cases we are building. Like, for example, we partner with HL7, with WHO, International Patient Summary Exercise, to exchange data who are coming to Saudi. So now they can use IBS technology to fetch their medical snapshot of their medical record when they go to a hospital in Saudi during Hajj or Umrah. So these kind of projects are becoming more and more of our DNA. So that's it. Before I leave, so this is my information. I would like also you to mark your agenda for the MedM for 2027, which is one of the most profound medical informatics, health informatics conferences across the globe, which will be coming to the Middle East for the first time in Dubai 2027 August. So thank you very much.
Thank you very much, Dr. Elhassan. That was wonderful, and especially considering the resource constraint setting of Bangladesh, this seems digital health career seems like a great opportunity for Bangladeshi early healthcare specialists or even early scientists to pursue such a career. And this was very informative. I would like to request Dr. Zakir or Dr. Mossadegh sir to say a few words because we would not like to hold you on for very long. Thank you.
Thank you, Rishik, for moderating this nice session. And thank you so much, Dr. Osama, for joining this session and presented a very nice discussion with us that would be very helpful for the researcher and scientist for the field of digital health. So you already discussed about three-section model approach that you are working on: the strategic foundation, workforce development, ecosystem integration. So what do you think about workforce development? How can we improve that sector? Can you hear, Dr. Osama?
Hello, I didn't get your question exactly.
My question is, for you already discussed about three-section methodology. I'm talking about workforce development. So, what strategies can institute or university use to align academic curricula with real-world digital health competency needs?
Yeah. So this is one of our targets. So even if you're talking about the team who's working on our competency-based framework is led by a full professor in medical informatics in King Saud University. So actually, the whole initiative actually is led by academics who are trying to build these competencies in a way that can be consumed by curriculums developed for universities. And we are not talking about bachelor level only, but bachelor's, MSc, and even also short courses.
That's very nice. Thank you, Dr. Osama. Professor Mossadegh, can you tell us about our HIVD or if you have any comments on today's presentation?
Thanks, Osama, for your presentations. Yesterday, I presented at a public university. It is one of the leading medical university in Bangladesh. I am a clinical trial expert. So I presented the AI in the drug development, where I mentioned that the twin, digital twin. Participants from the participants asking me, what is it? Biological twin, they know the biological twin as a physicians, they know the biological, but the digital is the new concept. You also mentioned the digital twin is some researchers are trying to develop the digital twins, but not so far I know that it is not yet completely designed or developed. Can you
Yes,
tell
yes, I think
something?
I totally agree with you. Digital twin is one of the domains that has a huge potential in healthcare, and it can be tackled in different levels. And I believe that the top level of digital twin, where you can have a team with multiple skills around even modeling, uh, cell level, tissue level, and so we can even develop what we can call artificial organs. And building those kind
Yeah,
of artificial organs will be very, very helpful in clinical trials. So rather than using animals, for example, you can use those complex mathematical models. So you can even try medications, new treatments on those kind of digital twins. I think that's the top level of it. But it can
yeah,
cascade even to very, very simple one. So as I said, it's more of um, I can say talent based. So the more talent that you have in different domains, that will help you more.
yeah. Uh, uh, Dr. Jakir already mentions that you are working, you are collaborating with some institutes, and you are interested in some institute to work in Bangladesh. Our research organization, Quest Bangladesh and HIBD are actively engaging, uh, discussing with some institutes and university in Bangladesh, mostly the private university, to research collaboration as well as the academic collaboration. If you are interested, Dr. Jakil will communicate with you. We can arrange some workshop, short
Yeah,
course,
sure,
or
sure. And
something.
I believe even in Bangladesh, I think because you have high density population, I think
Yes.
one of the core areas that you should focus on is what we call digital preventive screening for population, using tools, as
Yeah,
I mentioned, that can get vital signs out of mobile camera or whatever to do screenings at a large scale. And I think even because you have this density of population, you will be the best lab for these kind of technologies. And this will allow you to collect huge data that can be monetized one way or another. So we are already working with some of those startups working on this area, and would be more than happy to engage you with them.
Dr.
Thank you.
Jakir.
Yeah. Yeah. I will communicate with Dr. Osama later on. Thank you.
Okay, thank you very much.
Thank you.
Thank you, everyone. With that, we'd like to close this session. Dr. Elhassan, thank you again for your time and your presentation. Thank you, Dr. Zakir, Dr. Mosaddeq, and all of the participants. Again, I wish you a happy Independence Day to my Bangladeshi compatriots. And Dr. Elhassan, take care, stay safe. Hope to see you again soon, inshallah.
Okay,
Bye.
then. Thank you very much. Bye bye.
Thank you.
Okay,
Bye.
bye.